first case is about an antral-oral fistula in the maxillary right sinus, where some teeth were extracted and the alveolar process was taken out with it. When the patient was first seen, this defect had been there for 4 months and constant sinus problems, certainly fluids coming through the nasal cavity into the oral cavity. The patient was very unhappy. Since the defect was large and was open, the first step was to do a soft tissue closure procedure where we did a sliding palatal flap to be able to get the soft tissue closure. Once that was healed, and then the next step was to be able to do the bony reconstruction. Next is it shows a outline of the procedures that were performed after the soft tissue closure was accomplished. At this point, we opened up again through the soft tissue, dissected into the sinus cavity, removed the scar tissue, and we had an opening in the Schneiderian membrane. We lifted the corners of the Schneiderian membrane, elevated it to give us a place for our future graft. We placed a lamb bone sheet in there to act as the new floor of the maxillary sinus. Underneath that, we placed a composite graft which included cortical-cancers mixture, stem cells, and some platelet-rich plasma. That was placed and condensed in there lightly, and then we went back and placed a Memlock barrier, which is a bovine collagen membrane that had been soaked in PPP for about 20 minutes. Placed that over the composite graft material, and then did a primary closure with the sutures and left for 2 weeks. The next slide shows how that closure was accomplished. You can actually see where the root tip part that was removed, and you can see the amount of graft material that we were able to regenerate the alveolar process of the right maxillary sinus, ready for implant placement. Next slide shows, certainly down the road a good ways, where implants have been placed. Some locators were placed as a provisional prosthesis, and the patient left with a semi-fixed upper denture until ultimately we should be doing a permanent set of teeth on the top, but we haven't got to that point yet.